Well, I'm joining us now is Africa 54 health correspondent Linord Moudou. What do you have for us today, Linord?
Hello, Vincent. While the first trial of an oral cholera vaccine was successful and could speed up global efforts against the disease, the trial took place in Bangladesh, where cholera is endemic, and nearly 270,000 people participated in the trial. The vaccine, Shanghol, was given as part of routine health services to both adults and children and was found to protect against severe cases of cholera. The study shows that even with moderate vaccination coverage, cases of severe life-threatening cholera were reduced by nearly 40% among those vaccinated, which included children aged 5 and under. The report was published recently in the medical journal, The Lancet. And a new report says 1 in 3 people, or 2.4 billion people, are still without sanitation facilities. The Joint Monitoring Program report, Progress on Sanitation and Drinking Water 2015 Update and MDG Assessment, says access to improved drinking water sources has been a major achievement for countries and the international community. 91% of the global population now have improved drinking water since 1990, and the number is still growing. The report published by the World Health Organization and UNICEF says worldwide, only 68% of the world's population uses an improved sanitation facility, 9% below the MDG target of 77%. Now, the United Nations says despite progress made on the Millennium Development Goals, well, hundreds of millions more people are still poor and suffer from hunger. In a report analyzing 8 development goals set out in the Millennium Declaration in 2000, the United Nations says the number of people living in extreme poverty has more than halved from 1.9 billion in 1990 to 836 million.
The report confirms that the global efforts to achieve the goals have saved millions of lives and improved conditions for millions more around the world. The MDGs helped to lift more than 1 billion people out of extreme poverty and make major inroads against hunger. They have enabled more than 2.6 billion people to gain access to an improved drinking water source and more girls to attend school than ever before.
The number of children dying before their 5th birthday has fallen by more than half since 1990. But despite the gains, 16,000 children still die each day, mostly from preventable causes. And progress has been uneven across regions and countries.
Progress has not reached everyone. Too many people have been left behind, particularly the poorest and those disadvantaged because of their sex, age, disability, ethnicity, or geographic location. Too many women and children continue to die during pregnancy or from childbirth-related complications. And too many people lack adequate sanitation facilities, especially in rural areas.
WHO and UNICEF warn lack of progress on sanitation threatens to undermine the child's survival and health benefits from gains in access to safe drinking water. 1 in 3 people are still without sanitation. With regards to HIV/AIDS, Sub-Saharan Africa remains the region most severely affected by the HIV epidemic. There were 1.5 million new infections in 2013. Almost half of them occurred in just 3 countries, Nigeria, South Africa, and Uganda. World leaders are due to adopt a set of new development objectives known as the Sustainable Development Goals, SDGs, at the UN summit in September. The new goals aim to eradicate extreme poverty by the year 2030. And that's our Africa Health Report for today. Back to you, Vincent.
Wow, thank you very much for joining us today, Linord. Be sure to watch for Linord Moudou every Tuesday and Thursday for the latest health news in Africa, right here in Africa 54.